Hopefully this will wrap up connective tissues. We are on page 964, the very bottom. Systemic sclerosis, also known as scleroderma, autoimmune hardening of the tissue. And people that have this disorder, their skin becomes almost like the bark of a tree. It's very hard. And one of the signs in the elderly that get this is their wrinkles will disappear, but that's not a good thing. It's not a wrinkle treatment. It's worse. There's no moisture in the skin. When it's localized, it pretty much stays in the skin and muscle, but often it goes systemic, meaning throughout the body, and it can affect the GI tract, lungs, heart, kidneys, joints, blood vessels, and skin. And things like your blood vessels really don't like to have hardening, right? That can cause big problems. And we'll talk about some of the problems associated with the hardening of the different organs. Your book on 965 at the top of the page talks about Crest syndrome. You probably need to be somewhat familiar with that. It's an acronym: calcinosis, Raynaud esophageal dysfunction, sclerodactyly, and wow, telangiectasia. Some of these words. So calcinosis, um, calcium deposits in the tissue, Raynaud phenomenon. I think we'll talk more about that later on, but I have a sister-in-law that has Raynaud disease, and she's about my age, but when her hands get cold, they just turn a ghostly, awful looking blue, and they kind of ache too. So she has to be really careful about getting things out of the freezer, for example, to cook, or when she goes shopping, she can't get things out of the frozen food section without wearing gloves. And of course, in the summertime, she feels funny doing that, but she has to. It's caused by vascular spasms. So exposure to cold, it's an allergic reaction, you might think of it as, but it's not really an allergy to cold. But that's what autoimmune is. Normally, we do have a little bit of vasoconstriction when we're exposed to cold, but with Raynaud syndrome, the body doesn't know how to shut that off, and it just keeps constricting and constricting and constricting. Esophageal dysfunction. The esophagus is supposed to be pretty pliable, and you can imagine problems that might happen if that began hardening. Sclerodactyly, it's scleroderma of the digits, and flip the page and you can kind of see what this looks like, but the fingers kind of stick together, and so it becomes looking more like a flipper instead of fingers. And then the last one, telangiectasis, dilated superficial blood vessels. So those make up what is called Crest syndrome, and that's systemic scleroderma because it is a autoimmune disease associated with inflammation. Often they'll have a positive ANA assay, which, if you remember, that was positive with rheumatoid arthritis too. Treatment. First of all, eliminate any triggers that you can, like my sister-in-law wearing gloves if she's going to get things out of the freezer. But a lot of times people can't avoid triggers, or they don't even know what they are. Vasodilators, drugs that are normally used for hypertension, can also treat the Raynaud syndrome, the chronic vasoconstriction. Proton pump inhibitors would treat the esophageal dysfunction, make it a little bit easier to swallow the food. Small, frequent meals goes along with that. And of course, corticosteroids and immunosuppressives are your mainstay treatment for any type of autoimmune disease. Let me go back to this. Well, no, we'll move on. Polymyositis and dermatomyositis. Polymyositis, if we just break down this word, poly, many, myo, muscle, itis, inflammation of. So just inflammation of a lot of the major muscle groups. And then when it has a rash component to it, then it's the same thing. We just change it to dermatomyositis. Primary symptom is muscle weakness. And again, this is another autoimmune disease. It's an inflammatory condition, so all of those labs that would test positive for rheumatoid arthritis are probably going to test positive for polymyositis. as well. There's really not a known cause, just like with a lot of these. No one really understands what causes um, autoimmune inflammation, but it has to do with, it says the major activity producing pathology in polymyositis is infiltration of inflammatory cells causing destruction of muscle fibers. So it's just a constant breaking down of the muscle. That's why you're going to have these elevated muscle enzymes, which is another lab test that you would see. High dose glucocorticoids is the mainstay of treatment here, in immunosuppressants like chemo or some of those other ones that are used with rheumatoid arthritis like methotrexate. And then I added IgG here because my father-in-law has polymyositis and that's his treatment. IgG is considered a blood transfusion, even though it's not red. It's kind of a yellowy stuff, and it's a component of the blood. And it's very expensive, but he gets that every I think he's on 3 to 4 weeks right now. They're trying to taper him down to every 6 weeks. But so that's something that wasn't in your book, but I do know that that's a treatment for polymyositis. Bursitis, you've probably heard of bursitis. A lot of older people especially complain of that. It's inflammation of the joint bursa. And let me see if I can flip back to that very first slide I showed. Okay, my picture didn't really show it, but here where it says synovial membrane, this right here is the bursa. It's the fluid-filled sac, and the fluid that it's filled with is this synovial fluid. So when we have bursitis, we have inflammation of this synovial fluid, or the sac containing the synovial fluid. More information can be found on page 968 in that kind of bluish chart, and in fact all the rest of the lecture is going to come from that chart. So bursitis results from trauma or excessive use. Pain and limited range of motion are the problems that it's caused by, and big surprise, medical treatment of choice, NSAIDs, reduce inflammation. We might also try splinting, cold and heat, and progressive range of motion. So similar treatment to the osteoarthritis, and that makes sense because it's in real close to the same area. Carpal tunnel syndrome, you've probably heard of that or know somebody, or maybe even you yourself have the problem. It's compression of the median nerve in the wrist, and the main complaint is not only pain but a lot of numbness. It occurs in people who have a lot of repetitive wrist movements, especially writers or people who type or keyboard a lot. Splinting. Let's change this to splinting. There we go, that's better. Splinting. So a lot of wrist splints, you'll see people with carpal tunnel using those. There is surgery for it, but hey, who wants to be cut on if you don't have to be? So medication, splinting, different things will be tried before surgery, and surgery is only if these other things don't work. Here's that glucocorticoid injections. Again, we talked about those with osteoarthritis, and I said that those can only be used about 4 times a year, and it's an injection of glucocorticoids right into the joint capsule. And so you don't have quite the systemic side effects that you have with systemic glucocorticoids like prednisone, but again, you're limited to how many times a year you can use them. Ankylosing spondylitis. I just think that's a fun thing to say, but it's not a fun thing to have. Inflammation of the vertebral column. And where they get ankylosing, that makes you think it's in your ankles or something, but no, ankylosing spondylitis is a back issue. It can cause pain in the buttocks because it's going to kind of be a shooting type pain. That's how patients describe it sometimes. Low back stiffness. It increases the risk of spinal fracture, and the treatment, some of the same things we've been talking about. Nonsteroidals, DMARDs, again, that was those disease-modifying anti-rheumatic drugs. Methotrexate is probably the most common non-biologic, and then you have the biologic DMARDs, which are usually going to be your monoclonal antibodies. And then physical therapy. You might hear mention of this syndrome, Richter syndrome, which is a form of reactive arthritis. this is kind of odd. It's autoimmune in nature too, and it often follows a GI or a GU infection. So someone might have a urinary tract infection, they get over that, and then all of a sudden they have this, and here's the triad of it: arthritis, urethritis, and conjunctivitis. And you would think that has absolutely nothing to do with urinary tract infection, and really it doesn't. It's just, again, the body gets turned on, the immune system gets turned on, and it doesn't know how to turn itself off. So treatments, again, NSAIDs, antibiotics, and physical therapy. And the next two, I'm not sure how to pronounce. So if anyone knows and I'm saying it wrong, let me know. Behçet syndrome, autoimmune and systemic. It presents as oral and genital ulcers, but they're not sexually transmitted. These just happen because it's like an autoimmune type thing. It's due to chronic inflammation. It's also going to contain some eye inflammation and large joint stiffness. And again, these are all on that table that starts on page 6 or 968. It's not considered hereditary, but there does seem to be a familial link to people who develop this. And it says treatment varies based on the specific manifestations. And then finally we have Sjogren syndrome. Again, if I'm not pronouncing it right, let me know. And Sjogren syndrome is characterized by excessive dryness, and the areas that are most affected are the eyes, mouth, and vagina. It's autoimmune in nature, and it's going to accompany other autoimmune diseases like rheumatoid arthritis, for instance. So someone might have rheumatoid arthritis and then with an additional Sjogren syndrome. Polymyositis, scleroderma, and lupus are other diseases that are often accompanied by this Sjogren syndrome. Okay, I'm going to wrap this lecture up with just a real brief review of what we've talked about. A lot of the drugs that we talked about that are used to treat connective tissue disorders are used in a lot of different disorders. NSAIDs, first and second generation. Second generation is going to be Celebrex, and I'll explain more about that in pharmacology. Glucocorticoids, just like these are non-steroidal anti-inflammatories, glucocorticoids are the steroidal anti-inflammatories. So if we took the N off of this word and just called them SAIDs, then we'd be describing glucocorticoids. They're the most potent anti-inflammatory there is, but the reason we like NSAIDs is because glucocorticoids have so many side effects. Immunosuppressants like DMARDs, we talked about methotrexate, which is actually an anti-metabolite used in chemotherapy, which non-biologic, and we also have the biologic DMARDs, which are usually monoclonal antibodies. Anti-gout medication, the one to treat acute gout was the colchicine, and we said they could take it hourly until they cry uncle, right? Or start getting nausea, vomiting, and that will relieve some of the pain and get rid of that uric acid quickly. And then for chronic anti-gout, something that people take when they're not having symptoms, allopurinol and probenecid to keep those uric acid levels down for the long term. Bisphosphonates, Fosamax and Boniva, used to treat osteoporosis. These are the ones you have to take first thing in the morning before you eat with a full glass of water. Can't crush it. Got to sit up for 30 minutes afterwards. Lots of rules with those. SERMs, selective estrogen receptor modifiers. Avista is the only one I know of right now. It acts like estrogen to prevent bone loss, but doesn't cause cancer or cause the blood clotting like that cause heart attacks and stroke like as bad as estrogen. And then the supplements. Calcium, we said 1,000 milligrams for most people, up to 1,500 after menopause. Vitamin D, and then these herbal supplements that we don't know if they really work or not. Summary: osteoarthritis is different from rheumatoid arthritis. We talked about non-autoimmune disorders as well as autoimmune disorders. Autoimmune means the body's attacking itself. The immune system gets turned on and nothing turns it off. Treatments, we talked about non-medical, medication, and surgery. I'll see you in class.